Hello everyone, I am Dr. Benin. In this presentation, I am going to give 5 essential and basic tips and tricks which are essential for each and everyone who does root canal treatment. Stay tuned and let's dive straight into this presentation. The first tip which I am going to give is about the ideal patient and dentist positioning while doing root canal treatment. We would have seen many often that the dentist will be making to sit the patient in an upright positioning or maybe in a reclined positioning while doing various dental procedures. But I would recommend that while doing root canal treatment, this is the position which is needed so that there will be no issues while doing root canal treatment, and it will be easy to access the root canal easily. We can see that the patient is laying almost flat in the dental chair. Make sure always the patient lies flat in the dental chair while doing root canal treatment. Why is it? People often say that maybe for a mandibular teeth we have to make the positioning of the patient in an upright position so that it will be easy. No, but I would say that try this out. Okay, this will prevent the easy accessibility throughout all the teeth in the oral cavity. And the second advantage is there will be less strain for the dentist, and the third advantage is there will be a maximum mouth opening for the patient, and also it will be more comfortable for the patient in a lying down or a flat position. So from now onwards, I would like that if we are making the patient to lie down in a flat position in the dental chair, that will be the first step for the beginning of success in doing root canal treatment. So that will be easy to follow, at the same time very effective, highly effective and easy tip while doing root canal treatment. Okay, the next one that I would like to suggest is always position yourself in the 11 o'clock position. So why this 11 o'clock? Is it possible to approach all the quadrants of the teeth sitting from the 11 o'clock position? Yes, it is possible. Try it out. Maybe for a couple of weeks it may be a little difficulties, but once you get used to the position, all the 32 teeth in this oral cavity can be easily accessed by sitting in the 11 o'clock position. This will also give a clear vision even for the maxillary in the mirrors. So 11 o'clock position and flat positioning of the patient is very essential. The next important point that I would recommend is the foot of the dentist should be seated or should be placed properly, and there should not be any lifting or hanging the foot from the dental stool. No, that have to be avoided, and the foot should be flat and it should be kept properly in the floor. So by doing this, it will prevent the unnecessary hanging of the the overload to the spinal cord. Most dentists will be having back pain, neck pain or shoulder pain. Most of these are because of improper patient and dentist positioning. So this is one thing which is often overlooked, but it is very essential that we should have a foot properly placed in the floor. And the next one is the curve, which is often created by the dentist in order to go peep inside the patient mouth. So it is better to avoid bending so much, but once in a while that could happen, but don't strain yourself trying to see inside the patient mouth by bending in all the possible angulations, and no, that have to be avoided. So the next one is, which is often not even considered, that the thighs of the dentist should be parallel to the floor. The thighs of the dentist should be parallel to the floor. Why this is important? Because once you down the dental stool and you make your thighs parallel to the floor, all the strain that you are doing and the weight from the upper half of the body will be moved to the foot and it will be rested and it will be transmitted to the floor. Otherwise, there will be a unnecessary straining in the spinal cord. Do you have a back pain? Do you have a shoulder pain, or do you have any such things because of you may be practicing for so many years? Try this out. Make the patient to lie flat in the dental chair, sit in the 11 o'clock position, and properly rest your foot in the floor, and make sure that the dentist thighs are parallel to the floor. Okay, once you follow this, your back pain, shoulder pain, and all those things will ease off and it will disappear. I am following this principle for the past 12 years and I proudly say that I don't have any shoulder pain or back pain, and I have done more than 25,000 root canal treatments in the span of last 12 years, and I work often maybe from the morning till the evening continuously, and I don't have, because I follow this principle and I expect you also to follow this. The next important tip that I give for everyone is called the eye principle. We often insist the patient, especially those who are apprehensive, to tell the patient that we ask the patient, close your eyes tightly and don't think about the dental treatment which is ongoing, and you will feel free and your procedure will be very soothing and it will be ease. But that's not the possible. That's not that we should follow it. Okay, once we close the eyes tightly and if we ask the patient to open the mouth widely, both are contradictory. The eyes will always follow the mouth. So just try to do this. Keep your mouth open and try to close your eyes tightly. Automatically your mouth will also start closing. So on the opposite, if you are telling the patient to open the eyes widely and keep open, the mouth opening will be better. And the second advantage is, once you are doing some procedure inside the patient mouth, they will be seeing what is happening and they will open it widely. And once you take the hand out, they can relax, the muscles will be relaxed and they can relax basically. But otherwise, with the eyes closed, they will be thinking or expecting. The dentist is always putting their hands inside the mouth and doing some form of procedure, and so they will be extraordinarily with stress, they will be keeping the mouth open. So that will lead to some pain and early fatigue for the patient. So always insist the patient to keep the eyes open. So in that way, you will get a better mouth opening also. And the patient will also be seeing what is happening here. So you can also explain the patient. Just imagine you are walking in the dark and even if there is a cat is going, it will look or it will give an impression that there is a ghost over there. So the same thing happens. Even a small or a very mild pain which is perceived by the patient when the eyes are closed will be exaggerated. So always insist the patient to keep the eyes open so that it will be easy for the patient and also for you to do the treatment. So if you are worried that some dust particle or some debris might go inside, you can give a goggle or an eye shield or something like that, and so that the patient eyes will also be protected. At the same time, you and the patient are both very comfortable. The third tip that I am going to give is, while doing root canal treatment and maybe for most of the endodontic procedures, always use a front surface mouth mirror. I will just explain what is this, the front surface and the rear surface mouth mirror. Most often the dentist will be always using a rear surface mouth mirror. We can say that there will be a metallic part. On top of that, there will be a glass. So in this glass, there will be a coating. That coating can be on the top surface or the rear surface. If there is a coating which is given in the rear surface, that's a regular mouth mirror that everyone uses in day-to-day practice. The image which is formed on the rear surface of the mouth mirror or the glass. Okay. So what's the disadvantage? Whenever you are trying to see an object very closely, there will be a space, there will be a distance between the object that you are seeing and the real image which is formed in the mirror. So that is equivalent to the thickness of the glass. In endodontics, while doing root canal treatment, especially locating an orifice, or you are trying to touch the orifice with a probe or with a file, even if there is a small discrepancy, maybe 0.5 millimeter, you will not be able to pinpointly place that file or the probe or whatever it is exactly into the location that you are expecting. Why? Because there is a difference between the image what you are seeing in the mirror and what is there actually present in the tooth. So that have to be rectified. So in order to avoid that, we have the front surface mirror. So in this front surface mirror, as there is a metal coating, on top of that there will be a glass, and the reflective coating will be given on the top. So whenever we are seeing, the image will be formed on the top surface of the glass, and that's not the advantage. Whenever you are seeing any object, or whenever you are trying to touch a orifice with a probe, you will be able to see exactly where you are doing. So the discrepancy between the real object and the one we are going to see through the mirror will be prevented. So I recommend that for all endodontic procedures, it is better to use a front surface mouth mirror. So it is not very expensive, but for some reasons people don't use it. Start using front surface mirror in your practice. It will be great, and the chances that you locate all the canals and the time that is taken for placing the file or cleaning and shaping will also be saved. The fourth tip that I am going to give today is very, very important. Maybe among the 5 tips, I would say that this is the most important tip, which is very essential that we have to follow. Just imagine, most often we wear some glove like this, okay? So there will be some areas of this elevations and depressions and the loose fitting gloves, and you will be always constantly pulling the gloves like this, and even after that, there won't be a perfect fit. It will be keep on coming out of the fingers, and that's not the problem. So the real problem is whenever you are holding a file, for example an endodontic file, and let's keep that you are doing a watch winding motion. Okay, so what will happen is, let's see that. Let's watch the video, and once you are holding it and once you are trying to do a watch winding, the glove will get entangled within the file. So what's happening is, the loose glove is getting rolled over the file whenever we are doing a canal negotiation. So once this happens, there's no way that you will be able to negotiate the canal easily. And the second problem is, if you are using a locking tweezer, once in a while, whenever you are maybe locking a GP and you are trying to place it, this loose glove will also get locked in the lock of the locking tweezer. So then it takes time to unlock it and remove it and pull it out, and everything. It is a episode. The next is, I always recommend kneading the temporary filling material before placing it. Once you are doing that, again the temporary filling material will also get entangled within the gloves. So in order to avoid all those things, it is always better to have a glove which is tightly fitting. So if the regular glove size that fit for your hand is of medium size, go for one size smaller. If it is small, then go for an extra small glove. So this glove should be tightly fitting in your hands. So in that way, there will be no extensions. So it will be perfectly fitting in your hands, so that even when you are doing some watch winding with the file, the file can be easily rotated or twisted without the glove getting entangled or the file getting entangled within the gloves. All these problems can be avoided. Similar way with the locking tweezer or with any other purpose, it will be always easy, and it will be like a breeze that you walk in your patient. So for all endodontic practice, always wear a glove which is tightly fitting. Okay, the last tip of the day, let's see something which is very basic that every beginner in doing root canal treatment should know, whether we shall do root canal treatment whenever the patient is coming with systematic diseases or no. Okay, let's keep that the patient is having some cardiac diseases or some liver diseases or some diabetes mellitus or some endocrine or some neurological or whatever the diseases it may be. Is it advisable to do root canal treatment in such patients, or it has to be contraindicated? I have seen dentists saying that whenever there is an diabetes mellitus, you should go control and we should bring the sugar level within the normal, then only we should proceed with doing root canal treatment. I would say that for most systemic diseases, if the patient is healthy and look good and is cooperative and in a situation to cooperate for the entire session of your treatment, proceed with the root canal treatment. I would say that the liver diseases, cardiac diseases, endocrine diseases, or whatever the diseases may be, as long as the patient seems healthy for your eyes and have not been hospitalized maybe in the past 2 or 3 weeks and looks can walk inside the dental clinic by themselves without any support, we can always do root canal treatment. There will be no side effects which will occur if we are doing root canal treatment. Maybe provided should be a good under a good isolation, maybe with an antibiotic prophylaxis depending upon the general situation, but there is no way to deny root canal treatment, maybe like extraction. So those who are on anticoagulant, shall we do root canal treatment? Yes, we shall do root canal treatment even in those who are having anticoagulants without stopping the medications. But always make sure that while giving an inferior nerve block or any blocks, make sure that you aspirate it in 2 or 3 angulations. Make sure that it don't get your anesthetic solution get inside any of the blood vessels. So otherwise it is fine to do root canal treatment in patients with most of the systemic diseases. Maybe in some terminal illness, or if there is a big swelling or there may be a carcinoma, only in those situations we may have to avoid or postpone. Maybe immediately after radiotherapy we have to consult with a radiologist. Otherwise, most often we can do root canal treatment in anyone even though they are having a systemic disease. Okay, I will come with another 5 more tips, and I have basically made 200 tips and tricks for endodontics. I will be constantly making these videos and we will get in touch with more and more in the coming days. And if you want to know more about me, you can watch, otherwise you can stop. So I am Dr. Benin. I am associated with Rajas Dental College. I am working as a professor there, and I am as a postgraduate guide for the postgraduate students for the past 7 years, and I go as an examiner for various dental colleges and universities, and I am a Rajiv Gandhi University gold medalist, and I am in a private practice for the past 11 years, and I have completed more than 25,000 root canal treatment. Maybe it is not common for anyone of this age to finish this many root canal treatments, and I am into scientific research, and I am an editor for a scientific journal, and I make all these pictures what you see in this presentation by myself, and I do all these presentations in PowerPoint. And from my experience as an endodontist, I would always say that root canal treatment is a highly successful procedure. Even if you make some minor mistakes, maybe some 10% of mistake, maybe a little short of the root canal apex, it's still acceptable and the procedure will be still successful. It will not be the scenario in most other medical treatments. So most of the root canal treatments are uncomplicated. Just let's think about the complications which could arise, like a perforation, like an instrument separation, like a missed canal, like a over obturation, maybe an under obturation, maybe a fracture, or anything which is happening are all induced by the dentist while doing the root canal treatment. It is not the patient who is coming with it. So my aim is to learn the basic treatment for doing root canal properly. So once you learn that without doing any mistakes, the chances for the advanced treatments like instrument removal and under microscope and all those things can be prevented. So what need is a constant training. Okay, then I always feel that single visit root canal treatment is very comfortable for the dentist and also for the patient, and it is highly successful. The chances that the patient missing the appointment, not taking the medications, coming with missing the dressing, and all those things can be avoided by doing a single visit root canal treatment. And magnification is really helpful for an endodontist. But I always feel like that the tactile sensation is more important than a magnification. If you can develop the habit of improvising your tactile sensation, that's the best thing that you can learn in endodontics. So I say that it's not some random tips and tricks that I am doing in this presentation. It's all what I practice in my my day-to-day works. So you also can follow it. So thanks for watching. Stay focused. Have a nice day, and I will meet you people soon with another presentation. Thank you.